Very often, when a person seeks psychotherapy, they're doing so because they're experiencing some type of emotional pain, whether it's depression, anxiety, or perhaps just concerns about substance abuse or disruptive behavior within the family. What often is not known is exactly what is psychotherapy and is it effective in trying to bring about change? And the answer is yes. In effect, pain that we experience, whether depression or anxiety, is a result of how we behave and how we think. The good news is if we can change the behavior or change the way we think about things, then very often we can change how we feel. An example, if you were asked by your supervisor to come to their office to talk with them, you might experience initially some anxiety thinking, what did I do wrong? In fact, in that situation, we often inventory our sins to think of what we did wrong, and we start to experience anxiety. The anxiety is real, but is it based on reality? No. It's based on your theory as to what might happen. The point I'm making with that little story is that we do react emotionally to how we think. The good news is if we change our thinking or our belief system, then very often we can change how we feel. Psychotherapy is really a process of coaching, working with you as part of your team in helping to bring about change. You should always understand from your therapist what your goals are, what you hope to accomplish, what are the possible adverse effects of the psychotherapy. You're entitled to know that. The important thing is you work as a team, you collaborate with the therapist, you learn new skills. What you do outside of therapy is very often more important than what you do in therapy. If you have questions, always ask your therapist.